In this video, we'll talk about the keto diet and cancer. Cancer has turned into a serious disease in our modern society. While cancer was not a large factor before the 20th century, it did exist, of course. Our modern diet and sedentary lifestyle have made cancer the second primary cause of death, with 1,600 Americans dying from this disease every day. It appears that our bodies do not react well to being exposed to daily toxins. While any cancer treatment must be guided by your physician, it's a good idea to discuss the keto diet and what it can do to help the treatment of this disease. A cancer-specific keto diet may consist of as much as 90% fat. There's a very good reason for that. What doctors do know is that cancer cells feed off carbohydrates and sugar. That's what helps them grow and multiply in number. As we've seen, the keto diet dramatically reduces our carbohydrate and sugar consumption as our metabolism is altered. What the keto diet does, in essence, is remove the food on which the cancer cells feed and starves them. The result is that the cancer cells may die, multiply at a slower rate, or decrease. Another reason why a keto diet is able to slow down the growth of cancer cells is that by reducing calories, cancer cells have less energy to develop and grow in the first place. Insulin also helps cells grow. Since the keto diet lowers insulin levels, it slows down the growth of tumorous cells. When on the keto diet, the body produces ketones. While the body is fueled by ketones, cancerous cells are not. Therefore, a state of ketosis may help reduce the size and growth of cancer cells. One study monitored the growth of tumors in patients suffering from cancer of the digestive tract. Of those patients who received a high carbohydrate diet, tumors showed a 32.2% in growth. Patients on a keto diet showed a 24.3% growth in their tumor. The difference is quite significant. Another study involved 5 patients who combined chemotherapy with a keto diet. 3 of these patients went into remission. 2 patients showed a progression of the disease when they went off the keto diet. More studies are needed, but these numbers are encouraging. The keto diet may help prevent cancer from occurring in diabetic patients in the first place. People with diabetes have a higher risk level to develop cancer due to elevated blood sugar levels. Since the ketogenic diet is extremely effective at decreasing the levels of blood sugar, it may prevent the initial onset of cancer. From what research has discovered so far, the ketogenic diet may stop the growth of cancer cells, help replace cancerous cells with healthy cells, change the body's metabolism, and enable the body to starve cancer cells by depriving them of needed nutrition. By lowering the body's insulin level, the ketogenic body may prevent the onset of cancer cells. On a ketogenic diet, specifically for cancer, your fat should be at 75 to 90%, protein 15 to 20%, and less than 5% carbohydrates. Foods to eat: eggs, including yolks, all green leafy vegetables, as well as cauliflower, avocado, mushrooms, peppers, cucumbers, and tomatoes. When choosing dairy, opt for a full-fat version of cheeses, butter, sour cream, yogurt, and milk. Eat nuts such as walnuts, almonds, filberts, and sunflower and pumpkin seeds. Foods to eat in moderation: have 1 helping of root vegetables, such as yams, parsnips, carrots, and turnips every day. Fruits contain sugar, so treat them like candy, 1 small piece per day. A glass of wine, vodka, whiskey, and brandy once a week. No cocktails with sugars. A small piece of chocolate with 75% or higher cocoa content once a week. Foods to avoid: any food containing sugar, including cereals, soft drinks, juices, and sports drinks, candies, and chocolate. Limit artificial sweeteners as much as possible. Starchy foods such as pasta and potatoes, breads, potato chips, and French fries, cooking oils, and margarine. All beers. In this video, we'll talk about the keto diet and epilepsy. The initial use of the keto diet has nothing to do with weight loss or diabetes management, for which it is now so well known. Instead, the diet was created by a doctor in 1924 to help his patients suffering from epilepsy. Epilepsy is a nervous system disorder that can bring on recurrent seizures at any time. The symptoms can be spasms and convulsions or an unusual psychological view of the world. In any case, it's caused by abnormal brain activity. The severity of the symptoms varies from person to person, but a person is diagnosed with epilepsy if he or she suffers from more than 2 seizures in one full day. Anyone can suffer from this disorder, but it seems to affect young children the most, perhaps because the young brain is still in a state of development. Seizures are frequently managed by drugs. Sometimes they work, sometimes they don't. As far back as 1924, however, Dr. Russell Wilder of the Mayo Clinic conducted groundbreaking research and created the ketogenic diet to help children suffering from epilepsy. It was remarkably effective, but doctors lost interest when the new anti-seizure medications came on the market. It was easier for them to prescribe medication than to discuss diet. However, people who used the keto diet to treat seizures continued seeing remarkable success. Today, doctors are returning to using low-carbohydrate, high-fat diets to treat their patients. The results have been extremely promising. In 1998, the Journal of Pediatrics published a study involving 150 children who experienced seizures despite taking popular anti-seizure medications. The children were placed on the ketogenic diet for 1 year, which the researchers assessed their progress. 83% of the subjects were still in the study after 3 months. Over 1/3 of the children showed a 90% decrease in seizures. At the end of the year, slightly more than half of the subjects had remained on the diet, and 1/4 of them experienced a 90% decrease in seizures. The numbers indicate that the keto diet has a tremendously positive effect on children who suffer from seizures. The researchers consider it more effective than medication in many cases. For anyone with children who experience seizures, the inclusion of a keto diet in the child's treatment should be discussed with his or her physician. Another research on the effects of the keto diet on childhood epilepsy involved 145 children. The children were divided into 2 groups, with one group being treated with medication while the other group received a ketogenic diet. 74% of the ketogenic diet group were successful in reducing seizures. There have been more studies of childhood epilepsy and the keto diet. These have sparked new and considerable interest within the medical profession.